Hello, everyone, again. This is Mahshid Yassaei. I'm the co-founder and CEO of Tali. Very excited to be here hosting this webinar. This was a topic that was brought up to us from some of our customers that were thinking of implementing an AI scribe, selecting an AI scribe. They had heard great things, then they just were thinking about the actual practical steps to get started. Today I have with me Harrison Reilly. He has been with us for a long time, helping a lot of thousands of clinicians really get started with their AI Scribe project. A lot of organizations in the implementation project as well. So he will be sharing tips and tricks with us on what has worked best and made the project successful. And we are very excited to have Maryam Ebrahimpour with us today as well. Maryam is the Senior Director of Primary Healthcare Services at Regent Park Community Health Center. Regent Park was one of the early adopters of Tali in I would say, one of the more complicated implementation projects that we're going to learn about at the end of the session in a Q&A part of the session. If everything looks good, I will jump in and kickstart the session. If you're here, I assume you know about the AI Scribes and the space we are in. The study by Ontario MD last year and toward the end of 2023 showed 3.4 minutes of time saved per visits for a 15-minute visit. This is almost 20% more time available every day. Imagine like 2 hours more that you have to see more patients or just go home and rest, which I think the latter is the more common case we're seeing. But just to give you a sense of the massive opportunity this opens up in the healthcare space, at Tali alone, we have documented over 4.2 million patient visits in 2024. And if you do the simple math, you'll end up with almost 27 years of time saved on documentation and admin work. This is a massive, as I said, capacity that's returned back to the healthcare system, and we can't wait to see what we can do with all this time that's saved. So the first part of this webinar is going to be maybe 6 or 7 minutes only on selecting an AI scribe, some tips and tricks as we have talked to, as I said, thousands of clinicians, what is top of mind for them and how do they navigate those questions and decision-making process. So when we were thinking of what are the pillars of the decision-making process we keep seeing repeating for clinicians, we have identified these 6 pillars. Privacy and security obviously being top of mind for most clinicians, functionality and capabilities of the AI Scribe, the level of training and support, and how hands-on is your vendor in terms of getting you started, admin support, which Harrison is going to tell you more about, usability, and finally, cost seem to be the most important metrics in clinicians' times. Do you want to take it away, Harrison, and tell us about that? Okay.
Awesome. Thrilled to be speaking with everyone. And so, yeah, as Mahshid said, we'll go through these 6 pillars. Been really fortunate in my role at Tali, cross-section between customer success and operations, and helping individual clinicians all the way to large, complex organizations think about how to evaluate AI scribes and implement them. And so I'll be sharing those best practices tonight. So when we go through each of these 6 different pillars, what I'll do is I'll summarize across the 6, what are the most pressing topics that teams care about when evaluating an AI scribe? What are some of the most common questions that they have of their AI scribe vendor when making a decision? And then we'll do our best to summarize Tali's best practices and tips on how we've done our best to really answer these key questions and address these for teams of all sizes. And so we'll start with privacy and security, top of mind for so many. And really, what matters most when organizations are considering an AI scribe boils down to 3 key things. Patient confidentiality, being able to select a solution that easily helps build trust between clinicians and patients, and also selecting a solution that works seamlessly within an existing workflow and the existing technology within an organization without compromising privacy security and, of course, without compromising care. When it comes to key questions being asked by organizations, it largely stems down to data security and privacy and compliance. So common questions we receive at Tali all the time is when it comes to data security is where is data stored? How is it secured? If it's ever accessed or used, is it de-identified? And so those are some of the key questions that we're constantly getting asked. And then, of course, really wanting to know more. So when organizations are looking into vendors, what compliance measures do they have in place? Are they HIPAA compliant? Do they have any certifications like SOC 2 Type 2? These are the things that we really ensure are top of mind when we answer these questions, so organizations know how important this topic matter is to us, and we get all those questions addressed up front.
And I know, Harrison, a lot of these questions inspired you guys to prepare this handout or documentation on all of our security privacy overviews. If you want to talk a little bit about that, what goes into that document and how can everybody request some access to that document?
Yeah, absolutely. To make this process as easy as possible and give that transparency, we've actually worked really hard to develop a privacy and security overview document at Tali, transparently addressing how we handle data, how we manage our certifications and our compliance, and also just discuss in detail all of the protocols across privacy and security that we have as an organization. And we know that having that document ready, and we're happy to share that with anyone who'd like to review it after the session today. It's helped really navigate this part of the 6 pillars and have all those questions answered in one place. The next topic is functionality, so the actual features of the AI Scribe. And so this really boils down to what matters most for organizations for functionality. It's compatibility with existing workflows, so that could be compatibility with the hardware you have in place, compatibility with your EMR, but also at the end of the day, having functionality that's low stress. Delivering an AI Scribe that is efficient, it's accurate, and it's not complicating a clinician's workflow in any capacity, whether it be for virtual sessions or in person. The 2 things that we typically get asked as an organization is around note types and functionality, such as editing, customization, and integrations. So what integrations do we have in place? I know in the question someone mentioned MedAccess, they were interested about that. And so we have lots of material prepared to answer those questions. We thought in this segment, 2 things I wanted to share that are not typically top of mind for organizations, but end up becoming extremely important in the implementation process is platform resilience and session management. So that is, does the AI Scribe vendor that you're considering, how does it perform in environments that are maybe not traditional? So virtual versus in-person sessions, poor connectivity, or in situations where Wi-Fi is not that great. For example, is there an offline mode, which is something that we've delivered to address these key issues, because operationally, we want to ensure that folks can use the AI Scribe no matter what the situation is. And then the second piece is session management. So how easy is it to use the AI Scribe amongst team members? So that's easy to log in and out, easy to share devices, easy to access on the phone, and then look back at your notes later at the end of a busy day on a computer. So I would highly recommend to consider those 2 questions of your AI Scribe vendor when thinking about functionality.
Yeah, and I just want to add 2 cents here is that this is a space that's moving really fast. I think it won't be an exaggeration if I say we have a release every 10 days or so, which adds more capabilities, optimizes the software further. So it is important that the AI vendor that you go with evolves, but also prepares the knowledge bases and resources that helps you catch up with these new capabilities and functionalities. It is a lot of work, but I think it's essential in this space. So, for example, we're spending some time on making sure our YouTube channel is up to date with small 1-minute videos about new functionalities, same with our knowledge base. But I think in this space, because of the speed it's moving, it's an important consideration. Back to you, Harrison.
Awesome. Next is training and support. Just as much as it is important to think about the AI Scribe itself, it's what support's in place to make everyone successful. And that can be for administrative or decision makers, but most importantly, of course, the clinicians and their patients. And so we've worked really hard in our customer success organization within our company to focus on helping clinicians get streamlined adoption and reliable support. And we know that whether it be trialing or full implementation, having resources in place, whether it be self-serve learning resources or access to one-on-one support or group sessions throughout trialing a scribe has made all the difference in clinicians, 1, feeling like they can do this, they can implement it easily, but always have a place they can go to with questions. And we've, in learning about what clinicians really need to implement a scribe, we've actually created different programs to best support that trialing process. So one that's really self-serve with easily accessible online resources for maybe the single clinician or a small team who just want to get started on their own, all the way to more advanced programming for large organizations with hundreds of clinicians who need support with documentation, training processes and modules, et cetera. So we've tailored our programming to really match the needs of clinicians.
And I think this multi-channel approach is important, because if you have done any implementation project in your clinic before, you know that it's very hard to gather all clinicians in one room at the same time to do one session and make sure that everybody's getting trained at the same time. So having flexibility and adaptability to their schedule is super important. So we recommend that you have that as a consideration on is your AI vendor has the capabilities and the capacity to give you these options.
And just as I had mentioned before, as important to consider clinician support, admin support is also super important. And that's really for like larger organizations. If there's a decision maker or a team on the administrative side that's going to be rolling out an AI Scribe, we've thought about how to best support them too. So common questions we get from these types of decision makers is, how do we help with management and also measurement of an AI Scribe rollout? Can we actually see usage and engagement and what's working really well? And so we have some great tools that we'll share about how to help with measurement. Intuitive integrations, being able to help ensure that it works with existing hardware. At Tali, we pride ourselves on a solution that doesn't require any additional hardware in many cases, but making sure that we help with that testing phase is important, as well as documentation. So whether it be updates to consent workflows or infographics to inform patients, we do a lot of support there to help. And we know that's a question that's top of mind for administrators. And then lastly is executive coaching. So we know that the industry, when it comes to AI Scribe adoption, is moving fast. And we want to be able to at least create an environment where leaders can come to us to ask their questions, concerns, or their needs. And so we're equally fixed on supporting clinicians just as much as we are admin teams too. And so again, questions commonly asked is, how do we help measure success? So we have surveys, best practices to help with measuring success within your organization. And we have dashboards for large teams too to look at usage. Privacy and support really boils down to, we have a number of templates that you can customize for consent, for education, both for clinicians and patients, and we'll get into that too. Collaboration options, so how can we help create awesome environments or moments for clinicians to share ideas, best practice, tool tips, and we know that that's asked a lot of us, and working to actually make that happen for teams too. And then that advice piece, being that resource that executives or decision makers can go to just ask all their questions, and hopefully we can be helpful there. Next is usability. So this differentiates from functionality, really the features of the AI Scribe, but more about usability, so how it fits into a workflow. So easy adoption, and making sure that in the big picture that the solution is delivering on its promise of improving note quality and clearly saving time for clinicians. And so key questions that we recommend you ask of your AI Scribe vendor here. So user experience, what device options are available? Can it work on mobile? Can it work on desktop? We're actually really excited that we're going to be launching a web-based version of Tali in the coming weeks. And so being able to have Tali available wherever clinicians are without a heavy lift. So ask those questions. Next is access. Make sure that it's easy to sign in, easy to operate with your EMR or EHR, and also ensure that it's easy for teams to share devices securely and appropriately throughout the workday if needed. And hopefully your AI Scribe can work with that environment too. And so those are some key questions to consider, but many more to share, of course, as well.
Yeah, I just want to say a few words on the integration piece. When you're looking at the integration, I suggest you look at the immediate benefits and also the long roadmap. The immediate benefits that you usually get with the integrations is smart launch, so you don't have to install the software, authentication sync, so you don't have to manage multiple accounts, log in and log out, and also the auto-populating the chart. So these are the immediate benefits. But when your AI vendor has an official relationship with your EMR company, that opens up a lot of opportunity and room for further collaborations to save more time on other admin work before the patient walks into the room and after they leave the room. So for that reason, I think some of these considerations are immediate considerations and long-term considerations that need to be thought about, I guess. I can take cost as well. I remember the early days when we were launching Tali generally available. We almost spent 6 months on the pricing, deciding what would be the right price for this solution category, because it was a new solution category. There was nothing similar to it happened in the healthcare, where the return on investment is so massive for clinicians. But obviously the technology behind it is not cheap. So we were really struggling to decide what would be the right pricing. So it would be affordable, and also it would be a simple pricing structure. We didn't want to develop a complicated model of pricing where clinicians figuring out how much they need to pay every month would be a hassle in itself. But what we learned over time was that clinicians are actually a lot more curious and cautious about the return on investment rather than saving $10 or $20 per month. So if the quality of the note and the quality of the software is higher, which means that they're going to need a lot fewer edits into their notes, a few struggles, a few less clicks, I guess, in their workflows, they're happy to pay for that in their workflow. So what we recommend you take a look at in your decision-making process in terms of the cost, make sure that the pricing structure is transparent. So there's no hidden cost for training and implementation, etc. That there is a flexibility. So initially, we only had the full-time pricing for basically full-time clinicians. We realized that not everybody is practicing full-time. So we developed a part-time pricing for clinicians as well. Then we realized that there's this massive group of students and residents that would love to use the product, but they are not comfortable purchasing. So we made it free for students and residents. So this flexibility on pricing we think is important. And then that growth consideration again. What you pay today, you need to be comfortable if your clinic grows to double the size that it is so that you're still comfortable paying that price. Back to you, Harrison. Yeah.
I just wanted to quickly touch on that. This was a short segment, of course, but we know there are a lot of questions that go into each of these 6 pillars. So we've actually put together a evaluation framework to help you think through each one of these when thinking about AI Scribes. We'll share an email after our session today where you can request to access the free guide. And we hope that it is a great companion in helping you think about key questions you should ask of your AI Scribe vendor and hopefully help aid in your decision-making process.
Amazing. Now we come to the second phase, which is the implementation. You have made a choice to which vendor you want to go with. And if you have done any implementation in healthcare, again, you realize that it can be very complicated. It won't be as big as a hassle as your EMR implementation, but it's still something you need to be prepared for. So looking at what has made an implementation project successful and what were the concerns and the hiccups along the way, we frame the process into 3 phases. The first phase is preparing your team, creating the excitement, letting them know about the project, etc., which Harrison can talk about that. The second phase is the trial or the pilot phase. And the third phase is the full implementation. And what we learn is that if you do the proper planning, you can cut your implementation time by almost 50%. So let us get to that and talk about the details of each of these phases with Harrison.
Absolutely. So I'll kick it off. So we'll spend the majority of our time on phase 1 because, as Mahshid said, in working with companies and organizations as a whole and implementing an AI Scribe, proper planning does all of the heavy lifting for you. If you really can map out that time, you'll see huge success in the trial and the full rollout. When it comes to phase 1 or this first key step, the key activities that really boil down to 3 things. 1 is understanding workflows. So understanding how your clinicians operate in in-person sessions, in virtual sessions, and knowing their workflow helps you determine what processes might need to change to implement AI Scribe. One example could be a change in consent workflow. The second is educating clinicians. When you are ready to run a trial, both clinicians and patients have so many questions. So creating resources to answer those questions is super important. Examples could be clinicians asking why you went with a particular AI Scribe vendor, or when they can expect to have access to it. There's a ton of questions, and we'll dive into that, but having resources available is key in the prep phase. And then lastly is effective training. So working with your AI Scribe vendor to provide a lot of options for training, kickoffs, one-on-ones, and so much more. But the goal is have a plan in place to really build excitement with your teams. And of course, we know in the planning phase, there's a lot of work that gets involved, I should say, in getting ready for that trial. And our goal as an organization is try and make that really easy, hopefully on you. And so we put together a number of templates, documents, and patient information to make hopefully this preparation phase pretty seamless. So I'll go over the 6 documents or best practice literature that we have available. And that's something that you can reach out to us to inquire more about and get access to, of course, after the webinar today. So essential documents for clinicians, an AI Scribe overview, a document that gives an understanding of all the functionality and the benefits of the AI Scribe and things they should consider when looking to adopt it. One is an FAQ document, common questions, again, like why you went with an AI Scribe, when they can expect to access it, or any other tips that really will become a part of the trial phase. We have some documents put together to help answer those questions for your team. Also, AI best practices. So we know that there are a ton of questions that come into play for clinicians as a whole. So how to handle AI Scribe usage in sessions where there's more than one person in a room, when there's a translator in the room, so people are speaking multiple languages. Those questions are typically asked when AI Scribe tool is going to be rolled out. So we want to equip you with the best practices and questions on how to handle that, and that's a resource we have available. We also have a ton of resources available for patients. Sample scripts, so helping you make it easy for clinicians to be able to explain the AI Scribe in really easy language to patients. So we have sample scripts prepared. We have education infographics, things you can post in waiting rooms, at front office desks, or in clinic rooms as well, that answer all the key questions of what is an AI Scribe, what benefit does it have to the clinician, how does it impact me, in really simple and inviting language to hopefully give patients confidence in the tool and also just see how amazing they are in practice. And then lastly, which we'll get into in a little bit, is revised consent forms, templates that allow you to easily evolve your consent process to factor in an AI Scribe.
Yeah, and in terms of the testing timelines, we realized that every clinic, based on the type of the practice and the size of the clinic, is going to be different. But what we have seen work well for individual clinicians, usually 2 weeks is enough. Honestly, even 5-6 visits is enough for them to get a sense of how effective it's going to be in their practice. But 2 weeks is really giving them a sense of, like, when I go home after using an AI Scribe, how tired do I feel? How much time did I save? Different types of visits, all of that. With clinics of, let's say, 10 to 15 clinicians, we are usually offering an extended time of 4 weeks where clinicians can actually try the product with multiple clinicians, let's say 3 to 4, in a more structured format where they're going to have a dedicated account manager working with them and training everybody. And larger organizations is usually a couple of hundred clinicians or more than 1,000 clinicians. This is what we offer to a few OHTs as well when they were doing their pilot, is where it's a full-blown enterprise experience. We call it white glove program, where there's going to be enterprise-grade training and support available, dashboards, analytics, and everything. But even for the individuals, it's important to mention that even individuals have their channels and the structures of, like, having a free one-on-one with their customer success rep, or sending us a voice message, asking for help, sending email, calling us. All of those are available to clinicians regardless of their clinic size.
And once you've set up that timeline that works best for your team, 2 considerations we always recommend. So kickoff date and format. So for kickoff dates, so if you're running a 4-week trial, for example, making sure that it works well with holiday schedules, work schedules, to give the teams that are operating within the trial the chance to really try the AI Scribe to its fullest. And we've seen that factoring in that makes a big difference. Also, kickoff format. We've seen lunch and learns work really well for teams, as well as trying to get them in person or all together in one space, virtually or otherwise, when possible. as the benefits of getting everyone in a room to hear about the project, to learn about the AI Scribe, and see a live demo, see that aha moment all together, builds the hype and momentum around and makes your trial period way more successful. So we highly recommend considering that. And then, of course, carving out a bit of time pre-trial for testing the technology, making sure that all of the devices work well across virtual and in-person settings. So ensuring that the AI Scribe works with your virtual meeting software, works with all of your clinic room devices, checking hardware, making sure microphones work as well. We try to help teams by providing resources such as microphone recommendations in case they need it. The goal is that your solutions that are already in place or your hardware in place already will work. But taking that time just to carve out a testing period, even if it's a day, just to go into clinic rooms and assess that makes a big difference for that smooth trial period. And then lastly, planning for integration. So for example, we, on our side, when we are working with all of our partners from an integration perspective, if any trials they want to enable an integration, these take time, sometimes a few business days. So factoring in time to get the forms and the integration enabled, make sure to include that in your planning process. When it comes to some must-have best practices for teeing up a trial for an AI Scribe in your organization, we recommend 3 key things here. Start small. If you have a large team, consider, let's say it's a 15-person trial. Select in a small group to get the workflow right and the learnings right versus immediately opening it up to your entire organization. We've seen that work really well. And it also equips that first cohort of folks that are testing to be champions later down the line to roll it out to other clinicians too. Leverage experience. We're constantly surprised by how cutting edge and how excited clinicians are about testing different scribes. And so a lot of the times in your organization, you probably have clinicians that are already doing their own version of testing. So ask your clinicians, have you tried an AI Scribe before? Get their learnings and get their feedback to factor that into your trial. Leverage their experience, but also their testimonials to get folks excited about it. And lastly is diversify your test group. Mindset is everything. It's really not a matter of any other type of consideration other than a willingness to learn. So make sure that your clinicians are excited to test, and in leveraging the resources I talked about are FAQs and best practice documents, getting those in the hands of clinicians early, build that excitement, and hopefully translate into a really great trial. Next, we have phase 2. So we've done all this heavy lifting, processes are in place. Now it's time to do the thing and trial the AI Scribe. 3 key things that you have to think about is, so the most important thing is kicking it off on the right foot, that first training that takes place, ensuring all of your consent workflows are mapped and organized, and then establishing support channels so that everyone throughout the trial knows who to turn to or where to go when they have questions. Key things to think about here that I'll hit home again, and we'll talk about it a few times, is when it comes to hosting that kickoff, make it interactive, try to get everyone together in person, and try as well to have that opportunity to see a live demo, a test conversation between, in our cases, we run sessions where I'm the doctor and the doctors get to play the patient. It's amazing to see when you do that test session, they just get the value so clearly and the workflow becomes a lot more straightforward. When it comes to consent, make sure to think about how you want the updates to your consent process factored in. We have recommended to make sure it's embedded into patient check-in, intake processes, or if you do accept bookings virtually, to upload that consent workflow or that document into your patient portals. And then also have all of your infographics that you put together to inform users about the Scribe in different rooms, waiting rooms, office spaces, so that folks have great resources available to them. And then lastly is the support channels, making sure that your clinicians know that there's not just a kickoff, but the AI Scribe vendor can be there for one-on-ones. They can do follow-up sessions, but also a really cool opportunity for teams is to set up environments within the office to have folks share ideas. So community of practice, weekly lunch and learns. Once the value of the trial starts kicking in, folks, it's amazing what they can do to share template ideas and best practices and so much more. So establishing support on your side and also with the AI Scribe vendor makes a big difference. When it comes to the trial, this largely builds on the information that we created in the first phase of planning, but ensuring that all your consent forms are integrated into workflows, support FAQ, and also patient infographics are available. And one thing I'll note here that's been really cool for us to see is we know that sometimes clinicians want to actually let their patients know that they're adopting an AI scribe. So if anyone is interested to, we also have some email templates available that educate in really simple language what the AI scribe is, what they can expect, how it elevates care. And so we can share those resources out as well. But these three things are really important to ensure you have well documented at the trial phase.
A common question, and this is clinicians are asking whether they should have the consent as a written document or it can happen verbally. Just a quick note, we see that more than 99% of patients are okay. Majority of them actually prefer that their clinicians uses an AI scribe. But in terms of the recommendation, the first time you visit your patient, it's better if you have the consent written. And then in the follow-up visits, just acknowledge that they're still okay with you using an AI scribe, and in the follow-up visit, verbal would be, I think, enough. Back to you, Harrison.
Of course. Tips for kickoff success. So the first two, which I'll touch on here, is I've said it a few times, but try and get that team demo together. This sets the tone for an incredible trial period and has made all the difference for us, at least what we've seen in teams getting excited or getting common questions that are not so common out for everyone to hear. And they learn so much more together. And we know it's hard. So if it's not in person, it can be virtual. And we've also done some small group setting sessions as well. Just have to understand more about your workflow and what works best for your team. Also monitoring usage. So as I mentioned before, for some larger groups, we've been able to put together dashboards to identify top templates used, engagement, top usage, and also more importantly, identify users who are struggling and be able to reach out and see how we can help or unblock any issues. And so doing that fast and as quickly as possible at the start of a trial is huge. As well, discussing testing. In addition to that period of time where you're testing the technology, clinicians need time to test the AI scribe itself before they jump into a live session with a patient. So whether it's two clinicians trying it together, you book time with your AI scribe and you do a trial session, similar to what you would see in the kickoff. We usually see that takes 1 or 2 tries, but the immediate understanding of it becomes so much more clear after a couple tests, which is great.
And the last point about appointing a champion, I think we learned about this in a very organic way. We saw that trials where there is a clinician that's very excited about the AI scribe, talks about it and teaches everybody else, tend to become a lot more successful. So we decided that moving forward in every pilot or trial, we're going to appoint somebody as being that AI champion, or you can even come up with a official title for them, like AI Scribe certified clinician or something. But these folks are tech savvy. Usually they join all the lunch and learns and learning sessions with the vendor. They learn everything and then they spread it inside the clinic. And they can have a huge impact on whether the implementation project is going to be successful or not.
Absolutely.
2 more tips here. One is that the early days of a trial or pilot are very important. We are seeing that a lot of clinicians either in the first few days love the AI scribe or say, oh, this is not for me for whatever reason. So be available, like your AI vendors should be available for them on those first few days, which is important. The first few visits, making sure they don't have any problem and they can successfully use the product. And for the same reason, we suggest that you share those early wins with the rest of the clinicians. So if there's a clinician that's excited and shares the testimonial saying, oh, I can't believe how amazing this is. I can't believe how much time I'm saving. Share that with the rest of the clinicians in those first few days so that everybody actually humps over that first few tries and gets to use the product for themselves.
Especially if you're doing like let's say a portion of your team is starting the trial. It's amazing when those wins start coming around, how everyone starts piling in saying, hey, I want to try it. Hey, I want to try it. So that definitely makes for great buy-in. And so now phase 3, full implementation. The beauty of putting in the work during the first few phases hopefully means that this full implementation becomes very easy and straightforward, at least, leveraging resources that you've already put a lot of time and effort into. 4 key things that we recommend thinking about when you're finishing your trial period and you're looking to roll out an AI Scribe to your broader organization. One is don't underestimate the value of sharing trial learnings, those testimonials, those wins, the usage. That really gets the rest of your organization bought in, and the value becomes so clear. and also helps any decision makers or teams help validate their decisions to continue investing in AI Scribes, and also leverage training resources. So through the templated resources that you've used from a vendor, the ones you've created your own, those should largely, if they work in a trial setting, should be able to be the baseline for the resources you use for full rollout. So those consent forms, infographics, and you can adjust them and modify them as you go. But that's a lot of that heavy work already done for you. And those two things really definitely make a big difference.
And I hope by this time you have more than one champion. You have 10, 15 champions from your trial phase that will spread the word, help the rest of the clinicians get us started. So this is going to hopefully be easy if the trial phase has been successful. And the other thing is that the collaboration between the clinicians inside the clinic is very important. We see clinicians ask, like, how do I customize this template? Or remind me, how do I do this again, etc. So they have questions. If you can foster that collaboration inside the clinic is helpful. But that was really one of the reasons we came up with this project internally that I'm excited to share with you, which is Tali's community. So all of you are welcome to join as early users of our community. If you go to community.tali.ai, this is where you can share tips and tricks with each other. You can share your wish list with our product team and upvote or downvote our roadmap items. You can see product updates and webinars like this. But this is going to be addressing that concern of, like, is there a place where clinicians can go to talk to other clinicians and learn from each other and how to best save more time using AI scripts?
Awesome. I am very excited about this just because we know that there's an amazing amount of curiosity that clinicians have with wanting to fine tune their templates or understand how does a clinician like myself approach this problem or this note type. And so to give that space to keep the learnings going after a trial period is very exciting. So yeah, very cool news to share with everyone. And this just really concludes the information around implementation. This is just an overview of the different phases, but again, all of the resources that we had mentioned, the templates, the FAQ documents, the best practices, we want to share that with teams that are interested. And so as in addition to sharing our evaluation criteria, we are also going to be able to share with you our step-by-step guide for mastering AI Scribe implementation. We'll share out all the ways that you can access this information after today's session, but we hope it gave you some good food for thought as you're mapping out your journey to AI Scribe implementation, and look forward to answering more of your questions, both in the Q&A, but of course over email anytime.
Amazing. Thank you so much, Harrison. Now comes the exciting time of Q&A with Maryam. Thank you so much, Maryam, for being here. We have had the pleasure of working with you guys to implement Tali with your clinicians. And first of all, congratulations on being one of the early adopters of the technology. So this was exciting, but it was also one of the more complicated implementation projects we have done, because it was not just a large clinic with a lot of clinicians, but multiple organizations coming together, multiple locations. So we'd love to learn all about that. But maybe you can start telling us a little bit about yourself and your role at Regent Park, and then we can go from there.
Okay, for sure. Thanks, Mahshid and Harrison, for having me. Let me start with plugging what community health centers are, and I think that would center why I'm here and why Tali for us. For folks who don't know, community health centers have a rich history in addressing social determinants of health and equitable access to care. We are nonprofit organizations. We offer comprehensive care, community-centered approach with a lens of social justice and health equity. And we have an interdisciplinary team. In my role, I'm the Senior Director of Primary Healthcare, which means that I support many teams, primary care being one of them, allied health, mental health, and substance use. So that's a little bit about me in the nutshell, but I'm happy to expand on the project as well.
Amazing. I would love to learn, and that context is super helpful. Tell us what problem basically inspired you to look for an AI scribe in the first place, and what was the problem in the first place that started the project?
Sure. So let me first give a shout out to my colleague there. Geeta is there from Unison. I'm sure there are other folks that I maybe missed their names. Regent Park Community Health Center, alongside 4 other CHCs, have a collaborative partnership where we focus on quality improvement in the areas of primary care. The 5 CHCs, we have a common EMR system and a total of 87 primary care clinician. That's physicians and nurse practitioners alongside a large interdisciplinary team that serves clients that are the most complex. These are we call them clients, patients. These are clients who are facing food insecurity, homelessness, poverty, newcomers to the country, marginalized populations. So as you can imagine, there is quite a lot of complexity. To overlay on top of that, during COVID, there was a heightened complexity to the population that we were seeing. And community health centers were frontline throughout the COVID response and recovery. So we saw it firsthand, the burnout with the physicians, with the nurse practitioners, and the entire CHC community. And we're always looking for opportunities to improve patient care, but also considering provider burnout. That's how we started this project. We led new quality improvement projects every year. This was one that we really wanted to do. And what happened was, as many fundings go at the year end, we were provided with some year-end funding to be able to launch into some AI project. We did reach out to other CHCs in Toronto region to be able to expand this partnership, and we were able to invite 2 other CHCs. So in total, we're 7 CHCs across Toronto region focusing on this project.
This is amazing. Yeah, no, it was very exciting, and I totally get the for you guys the burnout is maybe more severe than anywhere else in the healthcare, and probably one of the more areas where AI Scribes can help a lot better. So how was the decision making process for you when you decided to select an AI Scribe?
So, like I mentioned, we have been thinking about different quality improvement projects. We had consulted with several other healthcare organizations, including other CHCs in the province, to see what they had recommended. Because of the tight timeline of the funding we received, we really needed to implement it within weeks and months of receiving it. We decided to pilot with Tali. Tali came and highly recommended for us. We felt that it was compatible with TELUS PS Suite, which is our EMR system, and we were excited to launch into this project.
Amazing. Okay, so you decided to roll out an AI Scribe, and it came to the implementation project. Tell us more about that. What was top of mind for you, and what worried you the most in the implementation project when you thought about this? As you mentioned, 7 different organizations coming together, 7 different locations.
So this is what really made this project exciting and challenging at the same time. We were 7 different nonprofit organizations with complex needs. What was on top of mind for us, and Harrison and you mentioned that, was certainly data security and compatibility and compliance for the data. So that was part of our work with Tali to truly understand what entails within the data agreements and the privacy agreements that we were developing.
Mm-hmm. And what resources were most helpful to you, and what tactics were mostly helpful for you during the implementation project that you can share with the rest of the folks?
Sure. I think for us, the important piece was the executive coaching. There was the desire from all 7 organizations to participate in this pilot. but we were mindful that we were not the subject matter experts, and we were stepping into new area that we weren't fully knowledgeable on. So what was really helpful for us was the executive coaching, to be able to walk us through the details of what would compliance look like, what would data security look like. Our physicians and nurse practitioners were ready to jump in. Though they were the early adopters, and what was really holding us back were perhaps on the leadership and decision making, to feel that we had the full information from a privacy perspective to be able to implement that. When we were ready, a few points you made were truly helpful. Having the templates of some documents was helpful for us to be able to move the process along. So, for example, having templates of consent within the 7 CHCs, we decided to each adopt our own workflow. We didn't feel like it was necessary for us to have a unified workflow as long as the work was moving along. And then having Tali join us from two perspectives, both for the decision makers and the executives, in terms of addressing concerns from an organizational risk perspective, but also from a clinician perspective, and just getting into the details of the actual tool and what would that look like for each user.
That makes a lot of sense. So there are a lot of folks in the audience that are at the beginning of the implementation project, or they're piloting an AI Scribe or thinking of piloting. What would be the maybe some key takeaways or advice you have for them in this phase?
This is my experience of it. I know that I'm not the most tech savvy, so so this is our experience of this as we're going through it. What we decided to do was focus this pilot project from a quality improvement perspective. So from the beginning, what mattered to us was to have a robust evaluation process. We chose to keep the evaluation on patient experience, on provider experience, focusing on cognitive burden, perceived burnout, increased connection between patient and the provider. So the advice I would have, I think if organizations are hesitant to start, is to start small. We picked 40 providers across 7 organizations to do this. We could have had our entire teams, we were all excited and ready to go, but we wanted to start small. It was important for us to have an evaluation where we're 4th months into the implementation, so we're eager to see what that looks like. Having the pre and post evaluation of each provider has been helpful. We have client experience surveys that are helping guide us, and we're excited in the new year to take a look at our data usage and the quantitative data that Tali produces for us on a monthly basis, to take a look at uptake with the patient experience. Do they feel that they have a stronger connection with their provider at those appointments? Do they feel that the tool isn't getting in the way of their appointments? Those pieces have been important for us. And in terms of key takeaways for the implementation, my recommendation is spending ahead of time quite a lot of time in terms of answering questions and concerns and developing best practices and procedures. We meant to start this project in May, and what we realized from May until August, when we actually went live, was it was the leadership, it was the organizational risk that we needed to keep into consideration, developing all the documents. We're still working on policies around AI, but that's the type of work that truly took the most amount of time. Also, we were 7 organizations, and we really wanted to make this a collaborative space for all 7 of us to come together. Once the actual go live happened, really the uptake was days within the working. So when the users are ready, the uptake is quite fast. It's the back end work or the front end work that takes quite a lot of time.
That makes a lot of sense. Congratulations again on being one of the first organizations to get us started with this and really setting the tone on how fast and how quote unquote easy it can be to improve the efficiency and quality at the point of care. And I can't thank you enough for spending the time with us and sharing your insights and learnings. We have 6 minutes, so I want to quickly go through some of the questions quickly. So the first question is from Peter. He's asking about the phone visits. So for telehealth visits that are happening over a web application, Tali has a telehealth option where it can hear the conversation on both sides. But if the conversation is happening over the phone, like a classic phone, that is where you would have to, yes, put the patient on a speaker right now. This has been brought up by a lot of clinicians, and I know the product team has done some research on how we can support the phone calls better as well, because we realize that you can't always put the patient on a speaker. So please bear with us on this one as we're trying to address that. Kevin Sampson is saying consider the 7th pillar being quality and performance. How good are the notes? How quickly are they generated? Absolutely. I think, honestly, I think the quality of the note that I'm seeing is probably the most important part of the functionality pillar that we presented, because the number of edits clinicians need to make on the edits can quickly become very frustrating. End of 2022, when we first released our AI Scribe, anything would amaze people. But as the market is being more mature and the solutions becoming more mature, the expectations are rising as well. And we are hoping that very soon the notes wouldn't require any edits by clinicians, but certainly a very key factor.
Can I jump in there from not from a tool perspective, but from an organizational perspective? That's been our focus. We are assessing the time spent on administrative task. At this point, we're collecting that, and we should have that in the new year. But I'll just share. We noticed our usage for October was in September. We had generated 1,000 notes.
Wow.
And in October, we were up to 1,400 notes. And to me, that's a testament that the providers are finding that useful, and it's saving time in their administrative duties.
That's amazing. Wow. Okay. Kevin Sampson is asking, web-based version available soon? Isn't it already web-based? No, what you're seeing is a Chrome extension. The web-based version that Harrison was talking about is where you can actually go to, let's say, app.tali.ai on your browser, and Tali will launch as a web application. So you will take the full space of the Chrome, basically, or your browser. This is not for everybody. We realize we know a lot of people love our desktop or our Chrome extension, but this is for those that require more space to edit their notes or work with their AI Scribe. And it's actually, I think, still we're on track to launch it the first week of December. So that's very exciting. Can Tali be used with Connect Care in Alberta? We're not an integrated partner. We're not an official partner, but you can still use the product as a application on the sideline with Connect Care and use it that way. I hope this answers. If you have a more specific question, let me know, and I will ask the customer success team to reach out and clarify this as well. Alizia, any updates about the scribing conversations on the phone simultaneously? Yeah, I thank you for bringing this up again. We know that supporting the phone calls on phone, actual phone is an important part of your workflows. We're certainly working on that. Does the personal level subscription allow for customized template? Absolutely. Customization of templates is available to everybody. Go to your settings, select your template, and then you can give it natural language instructions to basically customize your templates to almost no limit. My practice is 100% IME based. Are there any issues with the BC Supreme Court laws with the use of an AI scribe? Am I opening up myself to any legal issues by using an AI scribe in an evaluation setting? Also, is there any plan for the addition of a medical legal report template? Very good question. We did lots of research on this space. It's a new space, obviously, and you can appreciate that we're all learning together. But we talked to a few lawyers. What we are looking at it right now is that, first of all, notes in Tali or any AI scribe are not considered medical record. So you can remove them, you can destroy them, change them. And in Tali, you can delete your notes one by one, or you can delete your history. So you have full control over that. But this is, as you can appreciate, is could be a benefit or a disadvantage. Just recently, a clinician reached out to us and said it was a mental health visit where the patient really got angry and they said they started threatening that they're going to suicide. And he was like, what data is available on Tali? And we're like, if you have deleted it, it's deleted. But he was like, no, I need that information. I need to show the transcription and I didn't say anything wrong. So for that reason, is it that we know sometimes it's going to help you, sometimes it's not, is that it is in your full control whether you want to delete the note or you can want to keep a record of the conversation. But just so you know, as I said, the note is not a medical record, not considered a medical record. We can answer more detailed if you want to reach out. Learning about the product specifically, if you leave us it's an anonymous attendee. If you leave us your email address, we can set up a 101 demo for you. And the previous webinars that we had showed the product specifically. So he's asking, is he integrated with Akuro or do I have to cut and paste? We have signed the integration agreement with Akuro. We just passed their security and privacy requirements. So hopefully early in Q1, Tali will be integrated with Akuro as well, and auto-populate is going to be available there. Compatible with Mac products, absolutely. There is a desktop application available for Macs that you can install and use, or you can use the web application. The built-in MacBook Air microphone be sufficient? Yes, any default microphone are enough. iPhone microphone sufficient? Yes, you don't need any external microphone. Cost for full-time versus part-time doctors. So if you go with a month-to-month subscription, it's $150 per clinician per month, and annual contract is $135 per clinician per month. For part-times, it's $80 per clinician per month. But you can go to tali.ai/pricing and see the full pricing there. Where the audio recording is stored, we don't keep the audio file. So as soon as the transcription is generated, we drop the audio file because it includes the biometrics of the patient. So that is not stored at all. So your follow-up question of, do I have access to them at a later date? No, you don't. Thank you so much for the presentation. I am an addiction doctor who does inpatient and outpatient to shelters and the streets. I have been trialing Tali and loving it. Thank you. Any recommendations on how to teach or improve notes to have more specialized notes? You can customize your notes. Start with one of the notes that's already in the template section and start giving it like natural language instructions on how you want the note to be modified. If you need help with that, reach out to our customer success team, help@tali.ai. They'll go on a call with you and help you customize your notes fully. What about other languages? We support English, French, Spanish, and Farsi as spoken languages between clinicians and patients. So if you speak if you speak Spanish with your patient, we can listen to that and generate the note in English or French. More languages are coming. We are not turning out 200 languages at the same time because each of these languages, we do a lot of fine-tuning and optimization before releasing them. Some of the barriers mentioned by Maryam are currently being worked through by different government entities, privacy, security, data storage. How do you see this affecting implementation of AI Scribes? Maryam, do you want to take this? Putting you under the
Yeah, so that's for sure. There are different government entities working on it. I can tell you within our Association of Community Health Centers, we are working in supporting development of privacy policies. So I think what would come out of that is perhaps more collaboration instead of us recreating the wheel, working together in creating some guidance to support the organizations that are interested in uptake. At the end of the day, us 7 CHCs, we felt that AI is here just like any other technology, and we really needed to get ahead of the curve and trial it out for ourselves so we could support our industry in making sense of questions and concerns that are raised by providers and organizations.
Amazing. I know we are 4 minutes after 8. If there are no other questions, I think we can wrap up here. Again, Maryam, I'm very grateful for your time. Harrison, thank you for sharing the tips and tricks. The recording of the webinar will be available to everybody that registered, so you can take that up. And as always, please reach out to us at help@tali.ai for any questions, and we'll jump on a call to help you. Thank you so much. Have a great night.
Thank you so much. Take care.